Arthur has been diagnosed with carotid stenosis, a narrowing or blockage of the carotid arteries that carry oxygen-rich blood to the brain. It is a dangerous condition because it can decrease blood flow to the brain, increasing the possibility of stroke. For Arthur, there are several procedural and medical interventions to be considered. Choosing what path to take is not at all a simple decision. But there are new tools to help alleviate some of the complexity of medical decision-making like this. One of those tools, Procedure Order Entry or PROE, makes use of criteria to help physicians and patients evaluate and reach conclusions about which procedures would be more or less appropriate.
So there are three real options for patients who are found to have significant narrowing of the carotid artery. Optimize their medical treatment, that is, lower their blood pressure, control their cholesterol, get them to stop smoking. If they have diabetes, control their diabetes. Everybody gets that. On top of that, we might consider an operation to open up the artery and scoop out the plaque or the blockage that's causing the narrowing and then close the artery. And the third option would be to put a metal scaffold or a stent inside the artery to prop it open, get the blockage out of the way, and restore blood flow. And the decision about why to do that is largely based on a number of factors.
The goal here, as his physician reviews the options, benefits, and risks, is to agree on the best choice for Arthur, and to do that in partnership with him. PROE does not tell the patient the best choice, but provides valuable information that can inform the patient's decision.
As the surgery makes. So just giving you medicine is probably not the best thing for you.
Over the years, it's become clear that the expectations of the patient as to what they're going to choose to do and what will ultimately happen and what the outcome will be, all those expectations are much more likely to be realized if the patient's actually an active participant in the decision-making process.
So some of these are the risk factors associated with my diabetes, with my blood pressure?
So absolutely. So what you see here isn't just a random array of numbers. What you see here is personalized for you. So this took into account your diabetes, your blood pressure, your cholesterol, your medical history, and it personalized them just according to your medical history.
Wow, okay.
And so when I sit with a patient like Arthur, and I go through the PROE screens and describe, here's your situation, you have an 80% carotid narrowing, you don't have any heart disease, you're otherwise healthy, you have a good 5-year survival, and you're not having symptoms, the score tells us that you could either have one of these two options. Here's the advantages of one, here's the disadvantages of another. Let's come to a decision together. That way the patient feels invested, they feel as if they've made a good decision about this, and they can understand what to expect.
A clinical decision support system like PROE is most valuable when it's used in a decision-making environment that combines the physician's knowledge and expertise with the data-backed insight that PROE delivers and with the patient's personal background and experience, all within a culture that values shared decision-making.
And the future of this, I think, really helps us to show that you can marry information technology, informed consent, shared decision-making to optimal outcomes.